Start by washing your hands. Then put all the items you need on a clean table. You will need the following: 1 vial of MENOPUR. Be aware that the vial contains enough medication for several days of treatment. It's important that you keep the vial in the refrigerator until the medication is mixed. After mixing, you can store the vial at a maximum room temperature of 25 degrees for up to 28 days. 1 pre-filled syringe with solvent for mixing. 1 needle for mixing. Alcohol pads. 1 administration syringe for injection. A needle box. You can now start preparing the injection. Remove the protective cap from the vial of MENOPUR. Take the pre-filled mixing syringe and remove the rubber cap. Unwrap the mixing needle. Then attach the mixing needle to the filled mixing syringe. Finally, remove the protective cap from the needle. You are now ready to mix your medication. Take the vial of MENOPUR and place it in front of you. Insert the mixing needle through the center of the rubber top and slowly inject the liquid from the syringe into the vial. After inserting all of the solvent into the vial, let go of the syringe plunger for about 10 seconds to help release any pressure from the vial. Then, remove the mixing syringe and the needle from the vial. Gently swirl the vial to dissolve the powder. Do not shake the vial, as it can cause air bubbles. In the rare event that particles are seen within the solution, it should not be used. Your medication is now ready for use. If you do not use the medication right away, you can store it at a maximum room temperature of 25 degrees for up to 28 days. Be aware that the vial contains enough medication for several days of treatment. You should only draw the dose from the vial your doctor has prescribed for each treatment. You are now ready for your injection. Take the administration syringe and remove the protective cap from the needle. Carefully insert the needle vertically into the center of the vial. Inject the small amount of air from the administration syringe into the vial above liquid level. Now turn the vial upside down so the syringe is placed underneath it. Do not remove the needle from the vial. Then, draw the prescribed dose of medication into the administration syringe. Remember that the vial contains enough medication for several days of treatment. Remove the administration syringe from the vial and draw a small amount of air into the syringe. Keep the syringe upright. Then gently flick the administration syringe while holding it vertically, so that any air bubbles are gathered at the top. Carefully push out the air of the syringe until the first drop of liquid comes out of the needle tip. Your doctor or nurse has told you where to inject yourself. It is a good idea to choose a new site for each injection. Avoid injecting the medication into clear blood vessels or veins. Disinfect the injection site with an alcohol pad. Pinch the skin to produce a fold. Then insert the needle into the skin in one swift motion at an angle of 90 degrees to your body. Slowly press down the plunger to inject the medication. Pull the needle out of the skin. After removing the syringe, apply pressure to the injection site to stop any bleeding. Then gently massage the injection site so that the medication is well dispersed. You are now done with the injection. Do not dispose of used items into normal domestic waste. Your healthcare professional will advise you on how to dispose of these used items appropriately. Remember that you can store the rest of the medication at a maximum room temperature of 25 degrees for up to 28 days until your next injection. We hope that you have found the instruction video useful.